Hello everybody and good afternoon to all. Our today's topic is mechanism of normal respiration. Everybody is knowing from where respiration starts. The work of respiration is done by our respiratory system. This is the gross anatomy of the respiratory system which includes larynx, trachea, and both lungs, right lung and the left lung. Right lung is divided in three lobes, upper, middle and lower lobe, while the left lung is divided in two lobes, upper and lower lobe. Okay. Now what does the respiratory system does? It allows animals to move oxygen needed for cellular respiration into body tissues and remove carbon dioxide, which is a waste product of cellular respiration from the cells. Okay. Four major events takes place in respiration. The events are ventilation, diffusion, transport of oxygen and carbon dioxide in the body fluids and from the cells, and finally the regulation of ventilation. These four events make up the whole respiration. Okay. Now, ventilation of our lungs is dependent upon the Boyle's law. What is this Boyle's law? Boyle's law states that gas pressure in closed container is inversely proportional to the volume of the container. The pressure of the gas increases as its volume decreases, assuming constant mass and temperature. You can see the formula that pressure is inversely related to the volume of the container. Pulling up the lid in this container increases the volume and decreases the pressure. While when you push the lid down, it will decrease the volume and increase the pressure. Mechanics of respiration. Four major muscles are involved in respiration, that is the diaphragm and the intercostal muscles. The intercostal muscles are basically the internal intercostal and the external intercostal. Diaphragm increase and decrease the vertical diameter of the chest cavity, while intercostal muscles affect the anterior posterior diameter of the chest cavity by moving the ribs. Internal intercostal muscle, they move downward and backward, lower the ribs and sternum, reducing the anterior posterior diameter. Okay. Internal intercostal muscles reduces the anterior posterior diameter, while external intercostal muscle, they raise the ribs and sternum by moving downward and forward, and thus increases the anterior posterior diameter of the thoracic cavity. See, during inspiration the diaphragm is moving down, that is, it is contracting. When the diaphragm contracts, it moves downward and increases the vertical length or diameter, as you can say, vertical diameter of the chest cavity. While during expiration, the diaphragm contracts and decreases the vertical diameter. See, as the air enters, the diaphragm contracts and the ribs and sternum is raised, okay, thereby increasing the volume of the thorax. In the picture B, the diaphragm is relaxed and arch upwards, the ribs and sternum is returned to original position, and finally there is decrease in the volume of the thorax. See, during inspiration the chest wall expands both the anterior-posterior diameter is increased and the vertical diameter is increased. During inspiration, external intercostal muscle, they move forward. This movement is the anterior-posterior diameter of the chest wall increases in a bucket handle fashion. Okay, this increases in a bucket handle fashion. As you move the lift the bucket, you see, as you lift the bucket, there is increase in the this transverse diameter, and the forward movement is anterior-posterior diameter and the transverse diameter. Transverse diameter is increasing in a bucket handle fashion, and the anterior-posterior diameter is increasing in the pump handle fashion. Okay. During expiration, the external intercostals relax, the internal intercostals and abdominals contract for active expiration only, while the diaphragm relaxes. The chest cavity and lungs contract, the ribs and sternum depresses. Okay. During expiration, external intercostal muscles contract, diaphragm contract, volume increases, pressure decreases, and air passes into the lungs. While during expiration, external intercostal muscles relax, diaphragm relaxes, volume decreases, pressure decreases, and air leaves the lungs. What about the internal intercostal muscles? Internal intercostal muscles are active only during active expiration. Means when you are forcing the lungs to expire, then only the internal intercostal muscles come into action. Otherwise, during quiet expiration, only the relaxation of the internal intercostal muscles and the relaxation of diaphragm is sufficient to cause quiet expiration. What are other muscles of other or supporting muscles of expiration? The sternocleidomastoid muscles, the abdominalis muscles, and the facial muscles. These are the muscles that are supporting these external intercostal muscle and diaphragm, and they come into action only when you your active inspiration or normal inspiration is not able to give sufficient oxygen to the body. Means when there is labored breathing, then only these muscles come into action. Okay. See, by this picture you can see during the end of the expiration, what is happening at the end of expiration, the diaphragm is completely relaxed. Okay. These are the muscles of inspiration: sternocleidomastoid muscles, scalenus, pectoralis minor, external intercostal, diaphragm. These muscles are responsible for inspiration, and muscles for expiration are internal intercostals and abdominalis. At the end of the expiration, these muscles are relaxed. What happens at the end of inspiration? In labored breathing, additional muscles contract, causing additional expansion of the thorax. Okay. During quiet breathing, the external intercostal muscles contract, elevating the ribs and moves the sternum forward. And abdominal muscles are relaxed. The diaphragm contracts, increasing the superior-inferior diameter of the thoracic cavity. So, you can see during quiet breathing, Only the external intercostal muscles and the diaphragm are responsible. Okay, but during labored breathing, other muscles come into action. Now, what happens? How the air flows into or out of the lung? At the end of the expiration, what happens? The lungs is contracted. So, at, at the end of expiration means air has been expelled. The barometric air pressure is equal to alveolar pressure and there is no air movement. But as you start inspiration, during inspiration, there is increased thoracic volume. So, with the increase in volume, what happens? The pressure inside the lungs decreases. So, with increased thoracic volume, what happens? There is increased alveolar volume and decreased alveolar pressure. And barometric pressure outside is greater than the alveolar pressure, and this creates a vacuum inside the lungs and you suck in the air. So there is an air movement into the lung. At the end of inspiration, then again there is no movement. But as you start expiration, the diaphragm relaxes, the external intercostal muscle relaxes. What happens? The volume of the lungs start to decrease. So, decreased thoracic volume result in decreased alveolar volume and finally increased alveolar pressure. So, at this stage, what happens? There is increased air pressure inside the lung more than that of the barometric pressure, and the air moves out of the lung. Okay. Now, what are the factors that affect pulmonary airflow? First is pressure divided by resistance. Mm, flow is dependent upon the pressure and the resistance. Diameter of airways, especially bronchioles and sympathetic and parasympathetic nervous system. This is the simple explanation of inspiration. Diaphragm and external intercostal muscles contract, leading to increased volume of the thoracic cavity and decreased intrapleural pressure, which becomes more negative. Lungs expand and intrapulmonary pressure becomes negative, and finally air flows into the lung. Okay, you can see from this graph that during inspiration there is decrease in pulmonary pressure. Transpulmonary pressure is decreased, so air moves inside, and again during expiration there is increased pulmonary pressure and the air move outside. So what is the limit? You can see during the inspiration, at the height of the inspiration, the transpulmonary pressure is 753 S2O per centimeter, and during expiration it becomes positive to 762, more than that of the atmospheric pressure. Okay. Now we have to know about two pressure, the pleural pressure and the transpulmonary pressure. What is pleural pressure? Pleural pressure is the pressure between the two layers of the pleura. Okay. It is the pressure of fluid in the narrow space between the visceral and the parietal pleura. Normally it is slightly negative. The normal pleural pressure at the beginning of inspiration is minus 5 cm of H2O. it reaches about minus 7.5 centimeter of H2O due to the movement of the chest cage. Okay. The pleural pressure at the beginning of expiration is minus 7.5 centimeter of H2O to it reaches back to minus 5 centimeter of H2O. Okay. What will happen if this pleural pressure increases? How it will increase? Either because of the injury to the thoracic wall. When the thoracic wall is open, and what will happen? Air will enter in between the visceral and the parietal pleura. What will it do? This will lead to shrinking of the, because it will press the lungs from all sides, because this visceral and parietal pleura is enveloping the lungs from all sides. So when the air enters inside the lung, parietal pleura, inside the pleural space, it will press the lungs and there will be increased intrapleural pressure. Increased intrapleural pressure will compress the lungs. Okay. And this condition is known as pneumothorax. Okay. When there is an increase in air inside the intrapleural pressure, the condition is known as pneumothorax. And what is emphysema? Emphysema is also a similar condition in which also the pleural pressure is increased. Other factors which are responsible to increase or decrease the pleural pressure are deep inspiration, Valsalva maneuver, or the effect of gravity is also present on the pleural pressure. Intrapulmonary or intra-alveolar pressure. Alveolar pressure, it is the pressure inside the lung alveoli. During inspiration, there is decreased or there is negative pressure, minus 1 centimeter of H2O, slight negative pressure. This will help in moving the air inside the lungs. Slight negative pressure is enough to move about 0.5 liter of air into the lungs in the first 2 seconds of inspiration. During expiration, what happens? There is a slight increase in pressure, that is plus 1 centimeter of H2O. This helps to move that 500 ml or 0.5 liters of inspired air out of the lungs during the 2 to 3 seconds of expiration. So you can see that the funda is very simple in respiration. Okay, but this is governed by the sympathetic or the respiratory centers of our body. Okay, along with the intrapleural and intrapulmonary pressure changes. Okay, thank you. Keep your lungs safe. Thank you.